Hey guys, welcome to Art Building English. In this video, you are going to learn about what is Medicare and Medicaid. Before moving to the video, if you haven't subscribed my channel, kindly subscribe it and also press the notification icon for future video updates. Now let's start with Medicare. Medicare is the government national health insurance program in the United States. It was started in the year of 1965 under the Social Security Administration and now administered by the CMS, that is, Centers of Medicare and Medicaid Services. Medicare is the federal health insurance program for who are 65 or older, who has disabilities, and people with end-stage renal diseases like permanent kidney failure requiring dialysis or a transplant. It also called as ESRD. There are four parts of Medicare, that is Part A, Part B, Part C and Part D. Now let's look into all these types in detail. First, Medicare Part A. It's also called as hospital coverage. It helps cover your inpatient services in hospital, skilled nursing facilities, and hospice care, and some home health care. And you must meet certain conditions to get these benefits. Typically, most people don't have to pay a monthly payment called a premium for Part A. If you or your spouse paid Medicare taxes for a certain amount of time while working, and that's called premium-free Part A. If you didn't pay the Medicare taxes while you working, then you are not qualified for premium-free Part A. When you're age at 65 or older, then if you want Medicare coverage, then you can buy Part A for monthly premium. This amount may vary each year and is based on how long you or your spouse worked and paid Medicare taxes. And now let's see what are the coverage or not covered under Medicare Part A. Private room in the hospital or skilled nursing facilities unless medically necessary. Private nursing care. The cost of staying as a long-term resident in a nursing home or assisted living facility. These are not covered under Medicare Part A. Now let's move on to Part B Medicare. It's also called as medical coverage that covers outpatient services like doctor visits, X-rays, lab tests, and preventive screenings, etc. that Part A doesn't cover. You need to pay monthly premium in order to keep your Part B coverage active. Now let's see what are the services that are covered in Part B. Annual physical exams, laboratory tests like X-rays and blood tests, medical equipments like wheelchairs and hospital beds, orthotics and prosthetics, and mental health and ambulance services. These are covered under Medicare Part B. And here are some services that are not covered under Medicare Part B. Long-term nursing home care for more than 100 days, routine food care, cosmetic surgery, hearing aids, dental care and dentures, services that are rendered outside the US, and acupuncture, naturopathy. These services were not covered under Part B. Now let's move on to Part C Medicare. A Medicare Advantage plan, also called as Part C Medicare or MA. It is a Medicare health plan choice that are offered by private companies approved by Medicare. If you join Medicare Advantage plan, this plan will cover both Part A and Part B, that is inpatient and outpatient coverage. This plan will also offer extra coverages like vision, hearing, dental, and health and wellness program, etc. For this coverage, you need to pay a fixed amount for your care every month to the companies offering Medicare Advantage plans, and these companies must follow rules set by Medicare. And now let's move on to Part D Medicare. Medicare Part D, also called as Medicare Prescription Drug Benefit. It is an important part of the federal Medicare program and was created in order to help cover the cost of prescription drugs, which have long been a source for financial ruin for Medicare beneficiaries. It covers outpatient prescription drugs, and it doesn't cover OTC items like cough syrup and cosmetics, vitamins, and weight loss drugs. So far, we saw about Medicare and its part. In short, Medicare Part A covers outpatient services, Part B covers inpatient services, Part C covers both Part A and Part B, and Part D covers prescription drugs. We have seen about Medicare and its plan and coverage. Now let's take a look at Medicaid. The term Medicaid refers to a public health insurance program that provides healthcare coverage to low-income families and individuals in the United States. This program is jointly funded by the federal government and individual states. It is operated by state level, which means that coverage and administration vary greatly from state to state. And people who are eligible for Medicaid is low-income people's families and children, pregnant women, people with disabilities, and who are 65 or older. People who are under these categories are eligible for Medicaid program. Now, let's see what is the maximum income to qualify for Medicaid. For example, in 2022, the monthly income limit of an individual was $934 even, and for a family, that is a married couple with both spouse, when they are applying for a Medicaid, then their monthly income should be $1,367 or below. What if a family or individual is getting more than the eligible amount? For example, what if a family's income is $1,377? Actually, the eligible amount is $1,367, but they are getting extra $10, right? Because of that, if Medicaid was denied, then that family can use the spend down. What is spend down means? They should show some medical bills, like if they are buying any medicines for that month, then they can show that bill as a proof that they are spending every month for the medicines for some particular amount. Using that as a proof, they can apply for Medicaid. Then they will be eligible for Medicaid. This is applicable for the person who is getting extra $10 or $50, like nearer, if their salary is nearest to that Medicaid eligibility amount, then they can apply spend down. This is called Medicaid. And so far we saw about what is Medicare and Medicaid in detail. If you have any doubts, you can ask in the comment box. Obviously, I'll help you. And if you haven't subscribed our channel Arc Building English, please do subscribe and press that notification icon for future video updates. And thank you.